Dr. Jim Lippian writes to us and he says, I didn't join PDA for years because I thought it would be about pushing treatment and faster fillings. It is the complete opposite. It's all about ethical, patient-centered, comprehensive care. Does this resonate with you?
Yes, that unconscious incompetence. We don't know what we don't know, and we just assume that the only way someone could work faster than I do would be, or more productively than I do, would be to work faster. And it's a common misconception. It's you don't understand that in dental school, the dart into the calendar is how you schedule an appointment is asinine. It doesn't make any sense. We're the only industry that thinks talking about money is a sin, when the reality is we're trying to run a business, and therefore we need to be talking about how to schedule productively to hit this hourly goal. And it has nothing to do with whether a patient needs treatment or not. The patients are going to need the treatment they need irrespective. It's nothing with ethics. In fact, it's the opposite of that. We're going to learn from a risk profile, how to treatment plan to factor in the individuality of that patient. Therefore, it can last a lifetime. So, the reviews say, I learned more in 15 minutes with this guy than every dentist in my life, because we educate the patient based on their levels of risk and therefore treatment plan for the dental work to last a lifetime. And they say, he really cares about the outcome, which we do. And it makes you more productive. We start scheduling based on productivity. We put the appointment where it belongs, not just Tuesday at 2:00 for no reason. And it has nothing to do with ethics or anything. In fact, it's the opposite. You're going to take better care of your patients and be more productive. And by the way, I'm taking my office for a week in an all-inclusive 2 weeks from now, because we set these goals and they hit them, and they take a picture of every broken tooth and they do what they need to do to hit their goals. And it works me like a dog, but hey, now I'm working 3 days a week and producing $17.50 an hour. So I'm happy, they're happy, we're hitting our goals, we're taking a trip, win, 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 patient gets the care they need.
Woo! Okay, mic drop there. Listeners, this is exactly why we at Productive Dentist Academy have invited Dr. Jackson Bean, longtime PDA member, now presenter at the 20th anniversary Productive Dentist Academy conference coming up this September. And you just got a 30-second in your face, exactly with proof to receipt it up all the way, why we've invited you, Dr. Jackson, to be a part of this. And we're honored to have you with our doctors and team. So when you think back to your journey with PDA, by the way, for those who don't know, you are a practicing dentist out of Texas right now, currently. What is it that you've learned kind of along the way? It's been a long 20 years and you've been part of this journey with us since the very beginning.
Yeah, it's one thing you learn is, so I'm in a very rural setting, so 5 operatory office. And if you tell people we're doing 4 million, 5 they say, no, you're not. And it's like, all right, well, come see how the sausage is made. In fact, come in September and see how the sausage is made. You learn it's not about the household income of the community where you're providing the care. It's about finding patients that value oral health. And once you cultivate a group that values oral health, they're going to either buy the big screen TV, take a cruise, or get that front tooth or back tooth or whatever it is. It's just finding the patients that give a darn about their oral health and understand the link between those bacteria in their gums, your brain's right there, and the links, all the systemic links, and saying, I don't want to follow, in the footsteps of my parents, my ancestors. I want to be healthier, and a healthier mouth is step one. And so finding those people and cultivating them and getting into relationship with them. We have 32 teeth. And you think about how much money you can spend on one tooth, crown lengthening, or filling a crown, a root canal, an implant. You think about the value of one person that comes in the door, much less a family of 4. The family of 4 is so valuable. You get into relationship with a few of them that value their health. You're going to have so much dentistry to do. You're going to need an associate, work 3 days a week, like me. Woohoo!
What you're talking about here, I hear, is really being a trusted advisor in your community and learning how to build those relationships over time. I assume that your journey from maybe $300 an hour, I'm guessing, to $17.50 was not an overnight success, but you must have put in pieces along the way and systems along the way to get you to where you are now.
Absolutely. And that's, you said it best. It's systems along the way. And as we teach at PDA, there are relationship charting, there are little tricks, there are just little things. And Bruce said it in PDA number 3 or 4 or whatever the video is from, that I cringe when I watch, but he says it today. It's the little things that added together make that productivity to where, some months I'm doing over 2,500 an hour. And that's not, there's no one thing you can do to make you do 2,500 an hour. It's to get from 350 an hour to 550 an hour. That's the hardest thing, is just those little steps, because it's a mental shift. The doctors, go look in the mirror. Let me tell you who your enemy is. It's that dude right there looking back at you, because we believe these things. You've got to be unethical to be productive, or, it's just nonsense. But in dental school, we're not taught any of this stuff. I mean, who gets Bruce Baird as their practice administrator teacher? I mean, that's just dumb luck, and that it worked out. But yeah, it's a mental shift to increase that productivity. And once you start realizing to go up to the next level, and then you hear so-and-so doing this much and so-and-so doing this much, then it's possible. It's like the 4-minute mile. The 5-minute mile got run, then a 4-minute mile. Once you know it can be done, you just got to find out a way to be productive, take incredible care of who's sitting in that chair, and you can put systems in place to make it happen.
What I love about what you just said most is you're really squashing a lot of limiting beliefs. I can't because I only have 5 operatories. I can't because I'm in a rural area, or I'm in a busy city, or my saturation is too dense. There's lots of excuses, I think, that we all tell ourselves, regardless of even our careers, that stunt us from that growth that we really deserve to have. Absolutely. And the lifestyle that we deserve to have as well. So I think you hit on that really well. I'm thrilled to have you on main stage with Dr. Bruce Baird as well, and Dr. Wade Kiefer. So I think you are presenting on day 1, and you're going to go over comprehensive diagnosis and risk factors. And I know, talking with you personally, you've talked about risk factors and that conversation and how important it is in the practice.
Absolutely.
For you.
Absolutely. Yes. And so, yeah, once a patient starts to understand, wait a minute, you mean I don't have to keep doing this over and over again? I mean, okay, there's a hole in the tooth. We can take care of the hole in the tooth in this way, but how do we prevent another hole from forming in the tooth? What does that look like? Carry free in taking these steps and holding them accountable and documenting their responsibilities. And they're thinking, why does he get on to me when I do this stuff? It's us against the risk factors. And it's not me getting onto you, it's me holding you accountable. How are we doing on the Dr. Pepper drinking? Well, I've been slipping out. Okay. Well, now when you have new decay, it's not, it's not my fault. We make you go through that at PDA. It's not my fault. And it's so true. But in dental school, we have to unlearn all that nonsense they teach us, where they somehow by osmosis make us believe that if our filling fails, we did a bad job, when it has nothing to do, because the 3 teeth next to it are decayed. But we're not taught that stuff. And so we're going to undo a lot of beliefs at PDA.
Well, thank you so much for honoring us with your presence, and for all of the attendees. If you are listening and you want to come, and you have a team that wants to come, go to www.productivedentist.com, where you can register for our Productive Dentist Academy 20th anniversary conference this September 12th to the 14th in Frisco, Texas.